So we have a state exam coming up. Let's review and pass. We're going to start with our CNA state exam. We're talking about vital signs. Vital signs include the pulse, the heart rate, temperature, respirations, blood pressure, and pain is considered the fifth vital sign. Once again, when we're talking about vital signs, we're talking about the pulse, temperature, respiration, blood pressure, and pain. Let's talk about normal ranges of vital signs. The heart rate, the normal range is 60 to 100. The heart rate can also be referred to as the pulse. When the heart is less than 60 beats per minute, this is called bradycardia. This is a change and it needs to be reported to the nurse. Remember the prefix brady means slow. So when the heart rate is greater than 100, this is called tachycardia. Remember the prefix tachy means fast. So if the heart rate is greater than 100, you will report this. This is an abnormal value or measurement, and you will report this to the nurse. The normal range for the respirations is 12 to 20 breaths per minute. When respirations are less than 12, this is called bradynypia. This is a abnormal condition and it needs to be reported to the nurse. Remember the prefix brady means slow. When respirations are greater than 20, this is called tachypnea. This is also abnormal and it should be reported to the nurse. And tachypnea has been seen on the CNA state exam. Remember the prefix tachy means fast. The average blood pressure is 120 over 80. The blood pressure is written similar to a fraction, the top number over a bottom number. The top number of the blood pressure represents the systolic pressure. The heart is contracting during this time. The bottom number of the blood pressure represents the diastolic pressure. The heart is resting during this time. When a resident's blood pressure is consistently too high, this is an example of hypertension. When a resident's blood pressure is too low, this is an example of hypotension. On this chart, you see a category of different ranges for blood pressure. And depending on what facility that you're working in, the ranges may slightly differ. When you get in the range of 140 or higher, you should report this to the nurse. If you have a blood pressure in a range of 130 to 139, and this is a change for that person, then you will also report any blood pressures in this range to the nurse. So any abnormal measurements for that particular person or that particular patient should be reported to the nurse. And then you want to do it quickly. The average temperature is 98.6. A temperature greater than 100.5 is considered high. The patient is febrile and this should be reported to the nurse. Febrile means fever. A resident is considered afebrile if the temperature is normal when you measure it. Afebrile means without fever. Pain is the fifth vital sign. You want to report all complaints of pain to the nurse immediately. Phantom pain occurs in a limb that has been amputated or is no longer there. This has been seen on the state exam, the topic phantom pain. You want to report phantom pain to the nurse. To assess the apical pulse, use a stethoscope. And you should listen to the heartbeat for at least 60 seconds. The topic apical pulse has also been seen on the CNA state exam. An instrument used to measure blood glucose or blood sugar is called a glucometer. Glucometer is used to check blood sugars on patients who have diabetes. It's been seen on a state exam, and you should be familiar with a glucometer, which could also be considered an Accu-Check monitor. A normal blood glucose range is 70 to 120. If the blood glucose is less than 70, you want to report this to the nurse immediately. Hypoglycemia is also known as having low blood sugar or low blood glucose. Symptoms of hypoglycemia should be reported to the nurse, and they include confusion, heart palpitations, shakiness, and anxiety. Remember the prefix hyper means above, beyond, or high. Symptoms of hyperglycemia are fruity smelling breath, nausea and vomiting, shortness of breath, dry mouth, weakness, confusion, coma, and abdominal pain. We're going to talk about supplies needed to assess vital signs. Sphygmomanometer is a long word for blood pressure cuff. This word has been seen on the state exam. What is a sphygmomanometer? An instrument for measuring the blood pressure, typically consisting of an inflatable rubber cuff which is applied to the arm and connected to a column of mercury next to a graduated scale. It's enabling the determination of the systolic and the diastolic blood pressure by increasing and gradually releasing the pressure in the cuff. Sphygmomanometer. The tympanic membrane is located in the ear. This tympanic membrane has also been seen on the state exam. When measuring temperatures using the ear, you must use a tympanic thermometer. And there is a picture of the thermometer on this slide. Tympanic thermometers are usually small handheld devices with a probe that is inserted into the patient's ear canal, at the end of which the tympanic membrane, a thin structure which is well perfused with blood, is present. When taking the temperature in the ear, remember, if the patient is a child under the age of 3, you want to pull the pinna down and back, and if the patient is a child over age 3, pull the pinna up and back. This is a test question. We're going to talk about glass thermometers. They're not used a lot in the healthcare industry, but they're still, the topic is still being seen on the state exam. They're rarely used because they contain mercury, and mercury is poison. If the glass thermometer breaks, special precautions must be taken to clean up the spill. You want to notify the nurse in order to clean up the mercury from a broken glass thermometer. Remember, the blue tip is used for the oral cavity and the red tip is used for the rectal cavity. When taking a rectal temperature, insert the thermometer 1 inch only. And you want to hold the thermometer in place. If the resident is drinking or eating something hot or cold when you are measuring their temperature, you want to wait 10 to 15 minutes before attempting to take their temperature to allow their mouth or the cavity of their mouth to return to normal temperatures. Before using a glass thermometer, remember to shake the mercury inside of the glass thermometer down to 95 degrees. This is a test question. Rectal temperatures are the most accurate. Remember only to insert the thermometer inside of the rectal cavity 1 inch. You want to hold it in place for at least 3 minutes. Temporal thermometer is used to measure the temperature using the forehead. Remember temporal and forehead. A digital thermometer can be used to take an oral temperature. And with the probe, the digital thermometer can be used to take a rectal temperature as well. The radial pulse is the most common place to access the pulse or the heart rate. You want to remember the normal range for the pulse is 60 to 100 beats per minute. The radial pulse is felt on the wrist just below the thumb. This is a test question. The radial pulse is the most common place to assess the pulse or the heart rate. The radial artery is the most common place to assess the radial pulse or the heart rate. Prior to taking a manual blood pressure, you want to assess the brachial artery. It's located in the bendy part of your arm. You should be able to feel the pulse palpating in the bendy part of your arm. That's the brachial artery. This is the artery that is assessed when you're getting ready to take a manual blood pressure. The stethoscope is used to assess the apical pulse. In order to assess an apical pulse, you must use a stethoscope and you must listen to the heart for at least 60 seconds. When weighing your resident, use the same scale at the same time to maintain an accurate measurement. Weight gain greater than 3 pounds for the resident's first recorded weight must be reported to the nurse. In order to measure the height of a bedridden patient, you will use a tape measure. If you have any questions on vital signs or the supplies you will use to measure them, please place your comments below this video and I will respond to them. We're going to review quickly some of the questions that could possibly be on the test with vital signs. You definitely need to know that tachypnea is when the resident is breathing fast. You need to be able to identify an abnormal heart rate. So in order to identify an abnormal heart rate, you need to know what the normal range is, and that's 60 to 100. So a heart rate of 48 would be too low, and a heart rate of 108 would be too high. You need to understand that with respirations as well. The normal range is 12 to 20, so if your resident is only breathing six breaths per minute, this is an emergency. You need to notify the nurse. If your resident is breathing 30 breaths per minute, this is also an emergency and you need to notify the nurse. As a CNA, you're going to be monitoring the conditions of the resident, and vital signs are one of the ways that we can look at our measurements and see that our resident is changing. So it's important that you're documenting them accurately and that you know what normal and abnormal is. You want to remember that tympanic refers to the ear. You want to remember when you're taking an oral temperature, if the thermometer is colored, the blue part of the thermometer goes into the mouth. If you are taking a temperature and someone has been drinking something cold or someone has been drinking something hot, you want to wait at least 10 to 15 minutes before trying to assess their temperature. You want to report any abnormal temperatures to the nurse. If your resident is temperature is low, you want to add blankets or possibly adjust the temperature in the room. And if the resident is too hot, you want to notify the nurse and could possibly also remove blankets and adjust the temperature in the room. Also, with vital signs, it's important that you understand that during the systolic phase of the blood pressure that the heart is contracting, and during the diastolic phase, the heart is resting. You need to know that the sphygmomanometer is a long word for a blood pressure cuff. In order to take a manual blood pressure, you do need to assess the brachial artery. And when we are assessing the pulse, we assess the radial artery. The brachial pulse is located in the bendy part of your arm, and the radial artery is located on the side of your wrist where your thumb is present. You need to know if a resident has a fever, they are considered febrile. If they do not have a fever, they are afebrile. 98.6 is the average temperature. You want to report a temperature of 100.5 to the nurse. And you want to do things to comfort the resident, offer hydration and maybe cold towels if your resident is febrile. But always collaborate with the nurse to provide care for the resident. So if there are any questions, any other questions about vital signs, um, don't forget to comment below and I will respond to your comments. Thank you.